Morning, everybody, and we're going to begin with our Corona briefing. Little shout outs to our neighbor city of Mountain Air for the great face mask. Thanks. We have much to cover today, including a fairly substantial announcement regarding our efforts to add to the facilities available for homeless in our community during COVID and after. But we're going to begin with our basic COVID update, talk about enforcement, of course. We do have some city councilors who are going to join us at the end. And we also are going to talk about some of the holiday festivities. And so things are different, but we also have some very interesting things planned for today. So with that, I want to go ahead and begin. And of course, remind everyone that, of course, over the last month, we went through our reset statewide and, of course, here in the city of Albuquerque with respect to the public health orders. And, unfortunately, of course, the metro area is still in the same position really we were last week, in a sense that we have a long, long way to go to achieve any kind of change in our status with respect to the public health order. And we know that in many ways, this is expected for a large urban center in the middle of a rural area. So there's about 1,000 square miles between us and major other metropolitan areas such as Denver and El Paso and Phoenix. And so we know that folks from all of that area, they come into Albuquerque, right, to get their healthcare, especially, but of course, our shopping malls, our airport, all of these, and of course, family. It's just a function of our city and our community, New Mexico, where pretty much everyone has family in Albuquerque. So for us, we know that it's going to be a long road out of this, and we'll share some of the statistics that really point to this. But we also know that over the summer and in the beginning of the pandemic, we really came together to protect our community and to protect our loved ones. And so we know that there's real challenge, but we also know that our community can have resilience during these tough times. And we've demonstrated that time and time again for centuries, and also over the spring and over the summer. And so it is good that, at least compared to the high point a couple of weeks ago, our numbers are at least a little bit down from there. Now, we know that we, again, have a long way to go because the state has given us very clear criteria on when we can sort of achieve a different level of opening status. And so we're going to have to dig deep. We're going to have to realize that this is part of our everyday lives, and we all have a role to play to get our businesses open and to protect our healthcare workers and make sure that folks can do things like get cancer screenings because our hospitals have the capacity to do that, and they're not just filled with folks with COVID. So we know that we've got to count on each other to help each other, no matter which end of whatever debate or argument where you're on. We truly are in this together. So let's touch on a few of aspects of this in terms of what this actually means. And so I'm going to go ahead and share my screen and let's see if I might actually have to get a little extra permission to do that here. So we'll work on that in the meantime. And let me just touch on the fact that the state criteria, remember, is very clear, and it's 8 cases per 100,000 or a 5% or less positive rate. And so you can get one or the other, and you can move to yellow. You have to get both to move to green. So it's actually a pretty simple criteria. But as you can see, as I open this screen, we are not anywhere close to that. That's just the reality. And that's why we've got to keep up our enforcement, but it's also why we're going to keep up our support. Now, if you take a look here, you can see again where our numbers are compared to the state average. And you can see that we're, 10 times plus higher in terms of positive cases than we need to be. So we're just nowhere near that criteria for yellow on that front. Now, the positivity rate is probably going to be the first one we'll be able to achieve. And you can see that actually our positivity rate, and this is the 14-day average that the state tracks, it did move up though last week. And there's lots of speculation as to why this could have happened, but I mean, part of it was probably the warmer weather. And so also, we came out of the reset. So it makes sense that we saw a bump as we came out of the reset and as the weather warmed up. But 19.3%, obviously much, much too high and very far from that 5% that we all want to see. So as we take a look at our comparison between other cities, something we always like to do, these numbers they come from the Johns Hopkins sort of health program for around the country, and so that's how we track other cities around us. And I will mention that there is a little bit of a difference. Like these are 7-day averages, and I think they're taken like every Wednesday, whereas ours are taken every Friday, and they're 14-day averages. So there's a reason why there's a slight discrepancy on those, but there's footnotes at the bottom that explain that. But the trends are no different, and so just as a snapshot, you still see Albuquerque metro area being very challenged with positivity rate. That's that bottom row right down there. And we spoke to how far off that is from our state order. You do see still real positive signs in the percentage of our population tested. And so just briefly, I'm going to touch on how this is playing out over time. So again, we look at the Albuquerque metro area in terms of the confirmed case number. And you can see that we were actually throughout the summer just doing so much better than anywhere around us. And as you can see, which is the same case with positivity, we're now, all together in really the lower tier of these cities around us with very high rising case numbers. And so we are in a situation though, where, other than Austin, which frankly, to give them credit, they haven't seen the same spike these other cities have. All of the rest of the other cities, as you can see, are experiencing the same thing we are, but ours is still steeper. Again, unfortunately, we've lost ground compared to other cities when it comes to confirmed cases. But you really see some huge challenges in cities like El Paso, Salt Lake, Oklahoma City, Reno. These places are literally twice as dangerous when it comes to the number of positive cases per capita as we are. So some things to be grateful for, but lots of challenges in our community. Now, when we take a look at percentage of new cases or new positives, I think there is something really interesting showing up here, which is that some cities are making real progress, and certainly a good thing for those cities. And for us right here, we are seeing some progress as well. And so, we're hoping that because of the reset and the seriousness with which everyone's taking it and our high level of positivity rate over time as people quarantine, we do want to see that go down. So I think this in some ways is good news in that it shows hopefully some effectiveness to the measures that we're taking, both as governments, but also as businesses and as people in their individual lives. And you can see some other cities really seeing that as well. El Paso, of course, some big changes there. But you also see a couple of cities that just, continue to see rates go up. And of course, you can see Salt Lake as an example of that. So this is a little bit, again, about the world around us. And, we also know that we still have basics like masks, mandates, and travel quarantines and so forth. So some of these other cities do, some don't. It is varying. But again, you see us having much more challenges than we had in the past, but hopefully turning a corner. Now, if you look at deaths, it's a very sort of similar story there. Again, I would just say our healthcare system on these last 2 points has shown to just be very, very powerful and very resilient in these tough times relative to other cities. You see our rates, again, lower per capita than most cities. And then if you look here, I think this one is where we're doing the best. You see us as a percentage of population. We are almost twice as good as any city around us in terms of the percentage of population getting tested. And so as long as when you put all this together, the way this is supposed to work is we get everyone tested and then people quarantine. That is the key, right? Obviously, if everyone's getting tested and everyone's positive and they're not quarantining, then spread's just going to continue to go up. It doesn't matter if we're testing everyone. The point about testing is we are putting the responsibility on the individual. We are giving you a chance to drive down that positivity rate, drive down that spread rate by 1, getting a test, and then 2, if you're positive, following the quarantine rules. So for us, this actually does give us a path out. So when you see a city that has a high test rate, but also a high positivity rate, as long as people quarantine, those two things should go together and then drive that positivity rate down. So we have a path out of this, Albuquerque. That is good news. And it's because we have so much testing. But folks have to follow that quarantine rule when they're positive or when they're exposed until they get a negative test. And so that is our call to action in many ways right now in the city of Albuquerque, in the metro area. So with that, part of this is also addressing enforcement. And we continue to have a, relatively speaking, very heavy enforcement effort. Literally hundreds and hundreds of enforcement actions each week. You can see them, every red dot on here, all over the city. So with an update on that, let's hand it over to our Fire Marshal, Gene Gallegos. Gene.
Mr. Mayor, thank you very much. And thank you everybody that is joining us today. So again, with the enforcement updates, we are out there every day trying to do our best to ensure compliance of the public health order. This past week, the team has conducted 678 compliance interactions with businesses and individuals, 17 of which have been specific to face masks. That's whether we get a complaint from a 311 and we go out there and ensure that the business is making sure that all of their occupants are following the public health order and is making everybody wear face masks inside their business. And most of them are complying. So over the weekend, we did focus on visiting big box stores and non-essential businesses, making sure that they fell within the public health order, whether it be restaurants, making sure they were curbside only. And then we also went out to ensure that essential businesses were complying with the occupancy loads that have been set. And again, most businesses are complying. There's very, very few that are not complying. To clarify the occupancy loads for the malls, which we've been getting multiple complaints or concerns about, the team has worked with both malls to set their 25% occupancy load as a whole. They don't have to have the 75 customers or 25%. The actual malls as a whole just have a 25% occupancy load. Now, each individual store does have the occupancy load of 75 customers or 25%, whichever is fewer. So again, we, the office, my fire marshal's office, and the entire public health order team is happy to work with all businesses to keep their doors open and to keep them in compliance with the public health order. We continue to go out and do spot checks at all business types to ensure everybody is complying with the public health order. The team communicates with state police and New Mexico Department of Health if a business is not complying with the public health order. Currently, Crunch Fitness has been cited by New Mexico Department of Health for a civil penalty of up to $5,000 for being found in violation of the public health order during the 2 weeks they were ordered to close. New Mexico Department of Health will be handling all legal actions pertaining to that violation. The team will continue to regularly go out and respond to all 311 reports, investigate, and ensure that businesses are in compliance and answer any questions that we could. We want to remind all businesses, as the weather gets colder, please remember expansion of their outdoor services area must be approved by the appropriate local government's agency, either the fire marshal's office, the planning department, or alcohol and beverage control division. So if again your service includes liquor licensed premise, please complete the application for approval through the alcohol and beverage control division. That can be found on their websites. Tents may be utilized if approved through both the fire marshal's office and the planning departments, and we can walk you through that process. Tent areas must be open at least on 3 sides when in use by the public to be considered outdoor dining. So again, we want to remind businesses about that. Tent sidewalls may be added for security purposes when the facility is not in use. Opening for the actual structures, opening a garage door or all the windows does not constitute an outdoor dining area. And then also to keep warm, again, per the fire code, open flame or other devices emitting flame cannot be utilized underneath a tent or within 20 feet of any membrane structure. That's based off of the fire code and for safety purposes. So, and lastly, I'd like to again thank all the businesses, employees, and the citizens for working with us and following the public health order. Again, go out if you need to, support our local businesses, wear a mask, and most importantly, please be patient with all these businesses whenever you're at the stores and you're waiting in these lines. They're doing their best to follow the public health order and to keep everybody safe. So, but thank you again. I now turn it back over to Mayor Keller. Thank you.
Thanks so much, Fire Marshal. Really appreciate that. And again, a good just example of a team effort when it comes to enforcement and you know, pushing compliance above all. But you know, in some of the cases you mentioned, look, if folks just aren't going to follow the order, they will be punished and held to the account of the law. And so now we do want to kind of interrupt our regularly scheduled program to introduce an important new hire at the city of Albuquerque. And we want to share with the community a gentleman who's helping us out with our law enforcement connection to reform and to the community. And so I want to take the opportunity to introduce Pastor David Walker. And he's a former law enforcement officer and of course the pastor of Antioch Baptist Church. And he is our new liaison between the police department and the community on a range of issues, including APD reform. And community policing requires really constant engagement. And that's why we want to have this position at the city. And he's really our bridge builder and in many ways comes at a pivotal moment for our city. And so we're going to let him share a few words, and then he probably may have to drop off and so forth. And then we'll get back into homelessness with the Gateway Center, and we'll close with some of our events and cultural services for the holidays. But Pastor Walker, we'd love to hear a few words from you. Thanks so much.
Thank you for the introduction, Mayor Keller. Good morning. I want to thank you all for allowing me to be here, first of all, today. I'm very excited about the opportunity that has been afforded unto me to be able to serve as the community outreach liaison for the city of Albuquerque. I'm looking forward to working with the city, Chief Medina in the Albuquerque Police Department, and the entire community of Albuquerque. I take this as an opportunity to help build the trust and confidence between the police department and the citizens of Albuquerque. Most of you are aware this is the turning point in our reform. Different from reactive policing, random patrols, and reactive investigations, I think this must be a time that we collaborate, a collaboration between the people in the community and the police that address the issues and concerns to improve our relationship, which I feel ensures accountability and transparency. So I'm grateful for the opportunity to serve. I'm confident that I can bring something to the table to help build that trust and confidence that's needed to meet our goal of creating a stronger bond with the civilian police oversight agency, the community policing councils, independent monitor, as well as the CASA stakeholders and others. So I thank you for giving me the opportunity to serve, and I pray that God will intervene and help us get through these challenges that we're faced today. Thank you very much, Mr. Mayor, for the opportunity to serve. Thank you for, again, for the introduction.
Thanks so much, Pastor, and welcome to the team. And thank you for serving our community in so many ways, especially in this important role, as you mentioned, at a real pivotal time. thanks so much. And we will see you soon in some way, maybe virtually, but take care. All right, let's push on to some of our other topics for today. So earlier in our Homeless Coordinating Council, which is folks may know is a joint effort with county commissioners and city councilors and UNMH and well, UNM, I should say in general, the University of New Mexico, to really have a coordinated effort to deal with homelessness. We set this up, I think it started really in August or September, so it's relatively new, and it's been very helpful, and it's starting to bear some real fruit. We did announce today that we are moving forward to negotiate the purchase of the Gibson Medical Center. And some of you know this as the old Loveless. It's often referred to as that. And it is about a 500,000 square foot facility that, of course, used to house the old Loveless Hospital that I know many people visited for decades, including myself, family members and whatnot over there. And it's also, of course, right next to the VA. Now, voters overwhelmingly approved the city's investment that council also passed of $14 million into a gateway center. And we've since been working on this with nonprofits and advocates who are all part of this Housing Coordinating Council. And the concept, of course, that we all agree on is actually a network. It's a network of centers and a multi-site approach. Now, we do know that we still need one site to start with that is 24/7, right? That someone can go to either voluntarily with mental health issues, behavioral health issues, and homelessness, and even a place for first responders to take folks suffering from any of those afflictions. And until we have that 24/7, we're going to continue to see huge challenges when it comes to homelessness. And so this is an argument that I've made publicly hundreds of times. So happy to certainly flesh that out further if this is news to anyone, but hopefully it's not. And, you know, folks might remember that we agreed on sort of this need of a whole continuum of care and a system and a network that is in concert with other forms of government. And we really set that up through this coordinating committee. And then we did kind of come full circle and say, okay, now we still need a place where we can do all this, or multiple places where we can do all this. And we do want to have multi-sites. Right now, our only choice has been the West Side Housing Center. And of course, as a reminder, that is a 45-minute drive. And it's an old jail. It was truly designed just for emergency shelter beds in the winter and at night. Now, we've been keeping it open 24/7 since the pandemic hit and providing food out there, but that is all new. None of that was happening 3 years ago. And we also hired a medical director that's housed out there, which does provide testing. These are things very few cities are able to offer. We are. We, of course, also have about 630 people in total that we are housing. That is at least triple any, or at least double any number that we've recorded in the past. And that includes 5 hotels that we are utilizing for homeless folks. So the need is absolutely clear that we have to do something about this, both short-term and long-term. And this Loveless facility is large enough. Of course, it also houses the emergency COVID hospital. So these are all good things that we think will just be an asset for Albuquerque metro area, Bernalillo County in the long run. So we are, again, moving to purchase that. It is a real estate negotiation. And so there are legalese and confidentialities involved in that. So I'll address what questions we can, but some of those are, of course, just part of a natural negotiation process. Now, we know also that a real benefit to this concept is originally the idea was, well, let's build a new center or a few new centers. And as we looked at that, of course, there's 2 obvious challenges with that. Number one, it takes more time to build something new, right? And the urgency is now for every one of those individuals and every one of their family members who needs help. It also meant that, you know, we had a situation where we could use an existing facility and save that time. And the question was, well, what possibly could we use that would actually be helpful? And Loveless, the old Loveless, is really the only answer to that. This, at least, is a facility that we can utilize in months, not years. Every single other option would be years down the road. So for us, I think this is just more important now than ever. And as a reminder, there are existing tenants in there, even Turquoise Lodge and Haven Behavioral Health. This is a good thing, right? Because some of our key service providers are already there. So for us, we'll see where this goes. We're hoping in the next month or two to find out whether or not we can close on a deal. And so I do actually want to hand it over to Carol Pierce, our Director of Family and Community Services, which of course includes our housing and homelessness division. And she's going to walk through some of the specifics and also add really what is in that continuum of care that we're looking over time to build there and other sites. But because it's existing, again, we can move much faster and meet the needs of our community. Carol Pierce.
Thank you, Mayor, very much. Yes, through the Homeless Coordinating Council, it's really taking shape as this coordinated framework, identifying gaps and identifying high impact strategies, is really looking at what's needed to really address the needs of homelessness in our community. And I'm really grateful for all the work of the committees in the Homeless Coordinating Council. And I think this began quite some time ago about really listening to the community and knowing that this multi-site strategy is what will work best in our community in this system of care. And so what we do know that we don't have enough emergency beds. And as the mayor said, we've got the West Side. And I think we've seen this hands down in the response to this COVID pandemic. While we are providing emergency shelter for about 630 people right now, we're doing that in partnership with the county, the state, UNM. It's really a collective community effort to provide this safety net. So I think that's really highlighting this need for emergency beds. I'd also like to say, as we will know more, I mean, we've heard a lot, is homelessness rising in our community? I know we do see people on our streets and the fact that we're filling up these emergency beds, but we will know more precisely when the point in time count is done in January of 2021, right around the corner. And that is something all communities across our nation do every other year to really understand and go to shelters and go on the streets to conduct that survey. So the Gibson Medical Center, while it is being used right now to really provide part of that system of care for people who are impacted by COVID, and that's been a great piece of this puzzle that we're all solving for. And in that building, in the size of that building, it provides many opportunities to really relieve some of the pressure that we're feeling in our system and provide an outlet for some of those services. So our services committee, part of the Homeless Coordinating Council, has identified a lot of those. We've often talked about the need for something 24/7, where first responders or a person could go get out of the elements and be safe and be housed and have food. We know that on-site medical and behavioral health services are really important. And we've learned that out at the West Side. It's just a little complicated because of the distance to get out there. We also know, again, emergency beds are really important. And we're excited about the linkage and the system that's created there by Gibson Medical Center, with Turquoise Lodge being in there, Haven for Hope, two really important behavioral health providers. And we know that we have much need for behavioral health and addiction services in our community. I think the proximity to the Veterans Administration Hospital is a really great opportunity to figure out, again, how we work with the Veterans Integration Center and our veterans who may be experiencing homelessness to meet their needs. So ultimately, we always talk about when somebody is without a home, the pathway is to really find out what kind of housing can best meet their needs. And that is, it's a part of our current hotel system that we're doing with our partners, as it would be a part of the Gibson Medical Center as we use that to really expand these services. So it's a key piece of the strategic puzzle to address the needs of people who are homeless. And I think that it will really be a great location, an existing location in our community in the Southeast Heights. And thank you very much.
Thanks so much, Carol. Really appreciate that. And Yeah, I just want to emphasize the potential thesis for this facility, from that critical 24/7 drop off that we need, but on-site services, as Carol mentioned, also short-term shelter, but a pathway to permanent housing, and that's always the key. But you have to have the pathway. You can't just go right to housing, and I think that's a complicated part of the puzzle that this may actually help us really resolve. And so we're optimistic. So we'll see if the sellers will let us buy it. And with that, let's transition to some holiday events. We know the holidays are upon us and they're going to be different, just like Thanksgiving. But we also know that, look, we encourage everyone and hope everyone can find some joy in the holidays. It's important for all of us to celebrate what we can and with who we can, and to psychologically be there for each other. Now we know that's different, right? It's probably proximate family only, and very limited outings and things like this. But the city continues to try and also let you know what you can do, what is out there, instead of just telling you what you can't do. And so we continue to work on that. We want to have opportunities for families and small businesses. And so Brandon Gibson's going to go over some of those. Brandon?
Thank you, Mayor. I'm very excited to talk about some of the great holiday events we have coming up. And like Mayor Keller said, these will all be within COVID safe practices. The first event we're very excited about is the Route 66 Shop and Glow. That will light up Central nightly from 5 to 9 throughout December. More than 30 Nob Hill businesses have illuminated holiday light displays that our community can enjoy while shopping. Amid cancellations and temporary closures, the city of Albuquerque continues to support local businesses as well as the creative economy. Through the Route 66 Shop and Glow, the city has invested over $124,000 into local businesses and over $23,000 into local artists. Shoppers can take advantage of 2 free parking lots throughout Nob Hill, as well as parking along Central Avenue. Support local, shop local stores for your holiday needs, and grab some takeout from a Nob Hill eatery. After you're done shopping in Nob Hill, head west on Central to Old Town, where our giant Christmas tree is now lit and Old Town shops are open for business. Before you head out to shop, make sure you visit cultureabq.com for a full list of businesses that are offering curbside options, carry-out, delivery, and holiday specials. We're also very excited to announce that the Botanic Garden at the Biopark will reopen this Saturday with adjusted hours, including evenings. This year, evening hours will give our visitors at the Biopark an opportunity to safely experience the Botanic Garden's holiday displays. The Biopark is operating with strict COVID safety measures with limited guest capacity. Tickets must be purchased in advance through the Biopark's website. Lastly, later this month, look out for special virtual dance parties to ring in the new year, as well as our annual New Year's Before Dark family activities. Thank you, Mayor.
Thanks so much, Brandon. And I did forget, Brandon is the Deputy Director of our Cultural Services Department. And so thanks so much, Brandon. And again, I think just a good reminder, there are things to do and there are ways to shop local. Nob Hill, Old Town, good examples. And again, all those wonderful different takeout options and self-care options that are important now as well. So we're going to close, but before I get to some closing, we're going to touch base with a couple of our counselors who did want to share a little bit around education and so forth for businesses. And so I'm going to hand it over to our city counselors, and I'll let either Julian or them, I'm not sure who's first. So why don't I just say Counselor Borrego, and we'll start there.
Thank you, Mayor. Thank you to the staff, and thank you for the guests that you had this morning. I just want to acknowledge the mayor this morning. I'm Councilor Borrego, District 5, but I want to acknowledge the mayor, the administration, and the staff, and how all of them have stepped up to the plate to deal with this COVID outbreak and this pandemic. It's been very difficult for the city, for the state, I mean, for the entire nation and probably the world. But, you know, fighting an unknown is always difficult, and people live in fear is not something that we certainly want. We want people to be healthy and happy in our world, in our daily lives. And it's been difficult. And I definitely thank you for your sensitivity, Mayor, and for police and fire and all of our enforcement officers, the parks enforcement officers, our code enforcement officers, people who are out every day trying to ensure that we follow the health orders. And, sometimes that's not so easy. As you know, the reason that we are here today as counselors is that we want to follow up with the bill that we withdrew, which was Bill 2040, which would have given more tools to our enforcement officers to enforce the public health orders when they're harassed. And unfortunately, there are instances where they go out, to enforce the public health orders, and there's people or businesses that do not want to comply with those orders, and that's a reality. And so we withdrew that bill, but I think we don't want to look at tomorrow. We want to look at what's ahead of us. And in doing that, we want to join forces with the administration, with the mayor's office, to ensure that our public is protected as well as possible. And in that, we decided to turn our attention to an education campaign. And I know the mayor has already been doing this, but we want to make that stronger. We want to make sure that more and more people understand, what it is that we need to do in order to drop that peak that the mayor so eloquently described earlier in his graphs and his charts that show that trending going upward instead of downward. And so in the public education process, I always ask myself, the same questions: who, what, when, where, why, and how. And then in the instance of government, how much. Counselor Benton and I think Counselor Benton's going to speak in just a little bit also, we want to talk about, COVID, of course, and how we get those trends to come down and work in cooperation with our other elected officials to ensure that those trends start dropping. So that's kind of the issue on the table. I know the mayor is doing these public education televised seminars, or I guess he calls them town halls. So we want to partner with the mayor. We are looking at funding to ensure that, we don't want to recreate the wheel. We want to partner so that we can create a situation where the public is well informed. And that's what we're going to be focusing on. We are looking at funding that could become available to partner with the administration. There is still a little bit of CARES Act funding that might be available for that education process. And also we're looking at our general fund to see where we can supplement some of this educational funding. We are concerned with, continuing to be concerned with social distancing when people are out shopping, concerned that people don't spread the virus, can continue to wear their masks. Of course, the deputy fire chief talked earlier about percentages of occupancy in businesses. Those are very, very important that we continue to monitor those things and to ensure that we are creating that environment that's healthy. But we are also concerned with our government employees that are tasked with this effort. and that they are safe as well, because they have families to go back to, and they have people that are their loved ones that, and I go back to one of my nieces, who her fiance is a state police officer, and now he has COVID, and I'm not going to name any names, but certainly that has impacted our own families personally, and those sorts of instances where we do want to prevent the spread. So, Mayor, we look forward to working with you on this education campaign and moving forward to get through this pandemic and hopefully see the light at the end of the tunnel. Thank you for having me here today. And my office is always, of course, open to listening to our constituents and trying to move forward. Thank you.
Okay, thanks so much, Counselor, and appreciate that. And I know too, we could certainly use all of Council's help with all things public health order and education and enforcement and so forth. So let's wrap things up and get to our Q&A. We want to share one more visual with you, which is, I think, a good example of both what the Counselor and I mentioned. And it's some guidance in terms of, we get calls and questions all the time about different activities. Are they safe or not? Now, this slide is from, I think, MIT and Oxford. And it's just the best example we've seen as a guide. And it's pretty obvious, like green is good and, red is bad and yellow is in between, meaning your risk of actually getting exposed to COVID. So you can see across here, they differentiate between low occupancy and high occupancy situations. That's very important to understand. And of course, that's why we're reducing occupancies, right, is to push things into green. And then as you go down, you can, of course, see, whether or not you're wearing a mask, and you can see how much masks help. But I think the other category too is how long you're there, right? That also just has to do with risk. So this is just really about the math of risk, the probability of increasing your risk of COVID transmission. But you literally can chart your activities based on this. It's something I've done actually quite a bit. And so, you can just find yourself on this matrix and what you want to do or what your family is thinking of doing, and at least get a nice indication on whether or not it's low risk or high risk. So we put that up there just for folks going forward. All right, now I think with that, we'll go ahead. I think we have quite a few questions coming in. So we'll take them and then again, direct them kind of wherever is appropriate. So Maya.
All right, Mayor, we have our first question from Brandon Evans at KOAT. And Brandon, you should be able to unmute.
Hello.
We got you here, Brandon.
All right. So my first question is about the compliance efforts. How many people are doing these checks? And does the city or the state or the fire marshal's office have enough resources to make sure that people are complying with the health orders? And the second question is about the Gibson Medical Center. How long after the city closes on it, how much can you talk about how much it will cost, and how much time will have to pass after you close on it before you can start utilizing it? Because my understanding was that the state health department is currently using it now as part of overflow efforts for people. So just a little clarification about that. Thank you.
Sure. I'll try a shot at both of those, and especially our fire marshal can jump in on one if needed. So firstly, on your compliance, as just a throwback to when we rolled out our new compliance effort starting in October, roughly, what we did is we essentially acknowledged, like, number one, there's very few resources for compliance. And this is a challenge most cities have had. We came up with, I think, a very innovative idea that now a lot of other cities have copied, which is flattering for us. But we basically cross-deputized a number of departments to be able to do enforcement. Now, emphasis, that is a lowercase cross-deputized, right? It's not in the legal sense, but just strategically, we said we empowered through our own emergency order the environmental health department food inspectors, the planning code inspectors, our fire marshal's office, and even some parks and recs folks who monitor our parks to enforce aspects of the public health order. And so that freed up, the answer to your question is a couple of dozen folks in aggregate, plus about a half dozen APD officers who at any given time, it does depend on the schedule and weekends and so forth, we have an effective force of folks who can go out and produce all those red dots on the map that we shared earlier. So, to actually have 600 plus enforcement actions, you can tell that we have dozens of folks doing this, or else we, wouldn't even be able to do that. But now I would say this, you can't enforce your way out of this. There is no way with an Albuquerque metro area that, by the way, also includes the county, village of Los Ranchos. In many ways, Rio Rancho, we're just talking about for enforcement, right? We can only do that in the city of Albuquerque proper. And so even just for the city, that's about 600,000 people. Let's say you've got, 60 folks doing compliance, you're still totally outgunned in terms of what you can do for compliance. So, we essentially, I think, are in a better place than almost every other city, having roughly one person per 10,000 people. But that's still, obviously, you just can't have, we don't have the resources to have full compliance on everything. So that's why we take these folks and we have them focus on high risk areas. And also want to emphasize that we use that chart that I shared with you, and compliance is directed at areas where we are worried about spread. That's why you see them at big box stores. That's why you see them at gyms that are not following the rules. That's why you see them handling mass gatherings. That's what they're aimed at. Again, it doesn't make sense from a resource perspective to have them tell a single jogger going through the bosque, to cite them. We don't have the kind of resources to do that. We don't want folks doing that, but we need to focus our resources on where the spread is the highest. And we use the grid that I shared to help them target their activities. So Fire Marshal, anything else on that question?
Mr. Mayor, thank you. Yes, you hit it right on the dots, Mr. Mayor. Again, with all of those departments that you mentioned, we roughly have around 30 to 40 on any given day out there doing spot checks on specific big box stores, restaurants, and again, making sure the compliance is happening throughout the city of Albuquerque. So again, we are doing our best to keep the community safe and with the resources that we do have available. So we'll continue to do that, until this pandemic is over. Again, thank you.
You got it. Thanks so much, Fire Marshal. And again, just want to share this grid, right? I mentioned that, individuals can use this grid to help guide their activities and what they're doing socially or even personally. We also use this for enforcement, right? So areas down here in the red, that's where we're aiming our targeted efforts at. So, okay. Now the second part of your question, was I do remember it. It was the Gateway Center. A couple of pieces on the Gateway Center questions. Number one, in terms of usage, et cetera. So I guess first, the negotiation process for purchase is really dependent in many ways on the seller. And so, we may close fast, we may close in a long way, or they may eventually turn us down. We do know, and we shared, that there is the ownership team of that facility. There are some disputes around ownership again on their end. And so there may be some fairly routine but court actions just to understand who's got the right to sell and who doesn't and so forth. Again, not the city's issue, but to have a clean purchase, we obviously have to do that in a way that's approved by the courts. So we'll have to work through that. So the other thing is, in terms of usage, here's the great news. This facility is so big that there are no current tenants or anything that we would want to change. We want that state facility there. In fact, one of the smaller reasons why we're interested in buying it is to keep it there as long as the state wants it there, or as long as we make the argument that we need it there. So this is part of ensuring the future of that facility down the road, even for the COVID response. There is plenty of square footage, at least a third available, excluding all current uses. So there's plenty of room to run, if you will, there. But the timing, look, is really going to be dependent, again, on the real estate negotiations in the courts. But, you know, we should have this hammered out one way or another, let's say, in 6 months or less. I don't expect it to be prolonged further than that. But there is a chance that also we're just refused purchase of it. So it's not a done deal, but we are making the official legal action to put in for purchase.
All right, and next we have a question from Ryan Laughlin. And Ryan, you can unmute.
Thank you. And thank you, Mayor Keller, for taking our question. I appreciate you showing that matrix because it goes perfectly with my question. With the governor putting more onus on counties and municipalities to move from red to yellow to green, do you think the city could benefit from changing messaging? There was an LA Times article that said, you know, the just stay home message is kind of equatable to like just say no messaging. And some people aren't really listening it or heeding the warnings 8 months into this thing. Do you think people could benefit from hearing about what activities are more risky versus what activities are more safe, and condoning certain low risk behaviors for certain people might attribute to more compliance overall? What do you think about that, and taking a point position on communicating what the risk behaviors are to help us get the spread rate down?
Well, I appreciate that question, and I think it speaks right on to something. You know, we have always said that because the Albuquerque metro area is so unique with respect to the rest of the state, you know, we've always said that our approach has got to be our own approach. We have to carve our own approach. We also have to make it legally fit within the public health order. So, but inside the boundaries of the public health order, we know, right, I say words like this is an urban area, but to your question, you know, what does that mean? Look, we have hundreds of thousands of people living in townhomes and in apartments, you know, with nowhere to spread out, right? Nowhere outside to go. They don't have a backyard. And so that's why we have said that in a COVID safe way, go out and get that exercise, right? Go out and use our open space, go out and use our parks, but wear a mask, keep your distance, and then come back home so others can enjoy it and we don't reach capacity. And it's the same thing with kids and families who are always very concerned about the propensity for things like domestic violence, alcohol abuse, child abuse, to occur, you know, when folks are cooped up in a difficult situation with all the stresses of life, perhaps even as a single parent in a small apartment building. These are things that as mayor of Albuquerque, I have to consider guidance for activities and behavior for everyone, right? Not just folks who live in a house with a backyard. So that's why this chart, and I appreciate you allowing me to bring it back up because it really is where we're trying to point people. It's a little more complicated than just saying one thing or another. Your actual activity, right? I mean, you got to go to the grocery store. I was there last night. I was there waiting in line in the freezing cold, but there's a reason for that. And I also felt safe waiting in line with my mask outside for a short amount of time because that MIT matrix actually shows like that is a very low risk behavior. So I would just encourage folks again to try and use that chart if it's helpful. But just remember the basics, right? The basics are really what we need to do. Wear a mask, stay in your family pod, and you know, stay out of high density areas, high occupancy areas. There shouldn't be any because of the health order, but if you are in one of those, just leave. So that said, we want folks to do what they need to do for self-care. And I think that is very consistent with what the state has always said. We know we've probably got about 6 months to go, just as a rough estimate. And so we need folks girded for the long term. You can't just be like, well, this weekend, I'm not going to do anything because next weekend I'll go out and do all these things. we have to have a 6-month strategy. And so to do that, you just got to go day by day, activity by activity, and try and stay in the green on that grid.
Thanks, Mayor. Next, we have some questions from Chris McKee at KRQE. And Chris, you should be able to unmute.
Okay, cool. Thank you very much, Maya. I had a couple questions, Mayor Keller. One was related to the Gibson facility. I think Brandon asked the other couple I had, but any idea of which area of this facility or property could potentially be identified for this shelter? I guess I was always under the impression it would be the hospital part with the rooms and beds, but is there a particular building or an area you can point to of the hospital that you think that this sort of shelter would be fit for? Other part I wanted to ask you about was COVID hotspots. Yesterday, 129 new cases announced in zip code 87121. That's Southwest Albuquerque, Westgate, surrounding neighborhoods. Unser is the east border, I-40 is the north border. I'm just wondering if you have any insight on why this area continues to pop up on the highest numbers or zip codes with highest numbers of cases. The same thing, this was on the sort of high list in April. And is there anything that the city can sort of do about this or is trying to do to address this particular area? Again, that's 87121. Thanks.
Okay, thank you for that. There are, let's see, I always appreciate when you guys ask 2 questions and then I got to remember both of them. So let me try. First one on Gibson. So first off, we are going to, in some ways, take like one step at a time in a sense that, we've got to actually get this purchased. But to the options that we're looking at, what's great about the facility is there is lots of flexibility in the space. So in other words, there are large open corridors where we can have intake for folks, in a safe and in a warm way, where we can then have providers meet with them and again, sort of sort them out to the right place where they can get help. So we are interested in using that sort of those larger hallways and corridors and gathering areas that aren't, and none of those are being used right now. The other aspect is that, certainly we have 300 plus people in hotels literally right now. So, I mean, that makes a lot of sense, right? You get your own room, you get your own shower, you get your own bathroom, and you're not in a bunk bed with a bunch of other people. So to pay the hotels to continue to do this in the long run is of course very expensive. So the hospital beds, and there are many floors of vacant hospital rooms that meet this criteria. So we do believe like that population right now that we have housed in hotels, we could eventually move, in many ways to those hospital rooms. And that's just that is a premium way to actually get people interim help and shelter until they get permanent housing. So everything that would happen here is meant to be temporary and be a gateway to permanent housing. So no one should be staying there for that long, but of course, for a few nights, people need a place to sleep. So we like that option. The other aspect is there are buildings, there's roughly like 3 wings. So there's basically a wing and a half that are just totally available in terms of both beds and open spaces and intake spaces, right? There's old operating room areas that we envision using as exam space for initial medical screenings. And there's even, pharmacy space that we envision using as a pharmacy. And so these would all be with providers. The city actually doesn't do any of this directly, right? We contract with nonprofits who would provide these services. But there's also another building kind of around the backside. If you trying to, from a compass perspective, it would be the southeast side. There's a large building there that was just totally separate and also kind of out of view and out of the way that we might use for a lot of things as well. So the short answer is this is a lot of flexibility. That's why we love this space and a lot of room for partners. And again, that assumes everyone who's there currently continuing, including that emergency hospital. Okay, the second part of your question on 87123. So I would say a couple of things about this. Number one, I'm happy to speculate as to the answer to your question, but I want to emphasize that I don't have a formal answer to your question. In other words, I have no scientific basis for why that's happening. You'd really have to ask the DOH for that. But I do know, look, I mean, we have to kind of problem solve and think about these things. And so, we do believe it's in many ways a function of essential workforce. So look, as I always say, there is a huge swath of the Albuquerque metro area that does not have a choice to stay home. It could be because they are mandated to go to work. And that means a lot of frontline folks, a lot of hourly workers, and there is a lot of workforce housing in that area. And so that's likely one aspect. Of course, there are a lot of apartments and smaller houses. So one is also just people who, again, that staying home is not, it's a luxury. It's not possible for them. And so they may simply have to work for economic reasons. And so these, of course, then would increase spread at, workplace or in other parts of the city, and they just happen to come home to sleep in that zip code. So it's not necessarily about the zip code. And I would also mention what we're trying to do about it is continue just education, number one. And there's about a fourth of that zip code, of course, that's unincorporated. So the county is a real important partner there. And the biggest thing that we've tried to do is get testing out there. So we now have testing at Alamosa Community Center, which is really a hub in that area. And the city and the state are working together to provide testing there. And we also have testing somewhat nearby over at the First Choice Clinic, kind of at the other end. And so those are two ways, at least government's trying to help. But again, that's, I think, just informed speculation.
Thanks, Mayor. And I think our last questions today are going to come from Jessica Dyer at the Journal. And Jessica, you can unmute yourself now.
So you haven't mentioned what you guys are planning to spend or willing to spend, I guess, on the Gibson Medical Center, but I believe the city conducted an appraisal on it. Can you tell us what the value of the appraisal was? You talk about the flexibility of the space. Do you have any sense of how many beds this space could accommodate? I know for a while there was talk of like a 300-bed shelter. Is that still what you're thinking, that number of beds at Gibson, if the city is able to procure it? And what level of communication have you had with the neighborhoods around the Gibson Medical Center regarding your plans, and what specifically have you done to address any of the concerns they might have?
Sure. Okay. Let me try and touch on a few of those. And Carol Pierce, I think, can also fill in some gaps. I think there's one we'll probably have to forward you to Lawrence for. So let's see, in terms of the appraised value, certainly eventually that is always public record. I'm not sure if in negotiation phase it is. So that one, again, Lawrence or legal can give you a clear answer for that. As a reminder, the voters did approve 14 million for the project. So that would obviously be on the high end. Now, we, in terms of beds and so forth, Carol can probably speak specifically to that, but, we want to start, we'd have to start small no matter what. But certainly, there's opportunity for scale just by sheer existing demand. I mean, we're already literally housing 630 people. So that is already more than the entire facility would hold. So I want to emphasize that if the numbers sound big or small, they still pale in comparison to the housing challenge in our community. But of course, in conjunction with what we're doing at the West Side Shelter, what we want to do with smaller multi-sites, we want to take a big chunk out of the homeless population and provide short-term housing on a path to permanent housing. So that's certainly the goal, and we can't do that in increments of 10. That's just never going to get us there. So, and obviously it's not right now with 630 in emergency housing. So Carol might be able to add a little more on that. But before I hand it to her, let me speak to the community as well. I have had discussions with the District 6 Neighborhood Coalition on this, as well as the president of Nob Hill and the International District. Not sure her exact title, but some of the leadership in that area. And, they, I think, are very understanding that, like our city, we have to pick a place and move forward. And no one particularly wants it in their backyard. But the idea is, look, Loveless, where it actually is fairly industrial. Not industrial is probably the wrong word from a zoning perspective, but I mean, there's not a lot of housing right nearby. There is some, there's absolutely some. but there's not a ton of housing nearby, right? You've got the VA on one end, you have a nice commercial area on the other side. And I would say that there's going to be a lot of providers involved in this. So activating that space is also a reality, and this will happen with all the providers. So I think folks are interested in it being activated, not just being empty. And I would say that it is literally a coincidence, but we are talking about this location, literally 1 block from the largest economic development project Albuquerque has seen in many decades, which is the Orion project. So the city, which actually goes together in many ways nicely, but those neighborhoods around there, those are going to be some of the most, well-desired neighborhoods over the next 10 years for housing for the 1,000 to 2,000 jobs that are going to be coming into that Orion Center. So look, this area is going to be going through a massive uplift. And so I think to help make sure that we lift up everyone, it's only appropriate that we offer services for those who need some extra help. So in addition to the funding that we've been putting into this area of the city, we've repaved many of the neighborhoods around there for the first time in decades. We're adding 100 new streetlights to the area around there. We're, of course, providing the largest new library our city has built in quite some time in the International District. And we continue to support Nob Hill business development, including, helping fund them on numerous fronts through the pandemic. So again, we're trying to do, I think, all we can for everyone in our city, whether it's the businesses or the folks who live there or the folks who need extra help and shelter. So with that, Carol, any gaps you'd like to fill in?
Yes, thank you, Mayor. Just wanted to add, really recently with the requests from the International District, we have added pickup sites, bus pickup sites to get people that are interested out to the West Side Emergency Housing Center. We do have emergency beds available for anybody who needs them right now. And I think I just want to emphasize and underline what the mayor said about the Gibson Medical Center is a piece of this system that is so important in our community and the safety net. Emergency beds are a piece of it. We need multiple smaller sites. That is the vision. That's really important. And what's even more important is the connection to services, of which we have some gaps in our community. And the Gibson Medical Center is large enough that it can have a piece of that emergency housing, but that's not the end game. The end game is getting people connected to permanent housing and other services that they need. I also want to just add that we appreciate on the services committee, there are neighborhood representatives on there, San Pedro Neighborhood Association and the District 6 Coalition that we've had conversations with. Thank you, Mayor.
Okay, thanks so much, Carol. And that's all we have for today. I would just add on to that question. The point of these activities is to get people off the street. And so I want to remind everyone, I do hear a lot, oh, we're worried about, folks, transients in our neighborhood and this kind of thing. Of course, we all are, really actually throughout the town. And the answer to having less people on our streets is to pursue a facility no matter where it's located. And so to Carol's point, the whole point of doing this is to get people off the street, regardless of the neighborhood. So it actually should help no matter where it goes, every neighborhood in our city. So with that, we don't have any more questions. We're going to wrap it up and we'll see you again next time. Take care.